This is Professor Ha, and let's talk about Alzheimer's disease.
He knows a lot about science stuff, Professor Ha explains.
Ronald Reagan, Robin Williams, and Margaret Thatcher. What do they have in common? They are famous people with Alzheimer's disease.
Alzheimer's disease is one cause of dementia. About 2/3 of patients suffering dementia have Alzheimer's. At the time German doctor Alois Alzheimer first reported the disease, not many people had Alzheimer's. However, 10% of people aged over 65, half of people aged over 85 has this disease. According to reports in 2016, about 4 million people in America are Alzheimer's. Alzheimer's usually begins with small symptoms. For example, you forget about recent events or have a hard time doing what you've been doing on a daily basis. The rate of progression of this disease can vary widely depending on individual symptoms, such as memory confusion, personality, and behavior changes or loss of judgment. The patients gradually lose their ability to talk, which is caused by the difficulty of choosing words to carry on the conversation, the lack of thinking power, and the inadequate response to instructions. So, in the end, Alzheimer's end up in a state where they can't control or protect themselves. So, what do scientists know about this disease? What is the cause of this disease? Does the disease pass genetically, or is it exclusively affected by external factors? What drugs can cure this disease? Unfortunately, Alzheimer's is not much known, although there are lots of patients. Still, nothing has yet been cleared up for the exact cause. Scientists are compiling various symptoms from different patients to speculate on the cause.
However, scientists have found two common structural changes in brains of Alzheimer's. First, senile plaques are found in the outer part of nerve cells in brain. Simply speaking, these plaques are stacks of beta-amyloid. In our cellular membrane, amyloid precursor protein, or APP, is present. APP can be decomposed by alpha, beta, gamma secretase. When beta and gamma secretase inhibited, APP becomes small proteins that are soluble to cerebrospinal fluid and blood, which is okay. However, if they are activated, beta-amyloid is formed and is eventually accumulated. When beta-amyloid is accumulated in patient's brain, the immune system operates and inflammation occurs. The bad thing is that this inflammation breaks nerve cells. This is how beta-amyloid destroys brain ability.
Second structural change is neurofibrillary tangle. Inside the nerve cell, tau proteins approach microtubules by being attached to it. If tau protein is overly phosphorylated, it is detached from microtubules, and microtubules start to lose their rigidity and tangle. When the entanglement occurs, neurotransmitter cannot normally move between neurons, therefore, nerve cells slowly die. The unfortunate thing about this discovery is that we still don't know whether these changes are exact cause of Alzheimer's or just a result of Alzheimer's. 30 years have already passed since a number of giant pharmaceutical companies tried to find a cure for Alzheimer's. Unfortunately, there's nothing we can call a cure yet.
Although Namenda got approval from FDA in 2003, but it only slows down the progress of the disease.
Recently, Swiss company Roche's crenezumab and American company Biogen's aducanumab were on development. Both drugs tried to cure Alzheimer's by removing beta-amyloid in brain. However, they failed to pass phase 3 clinical trial in this January and March, respectively. Pfizer even officially announced that they are no longer putting their R&D resources to Alzheimer's.
Thanks for watching, guys. 좋아요 and 구독하기 to my channel please. And as always, feel guilty to email me. junsuha@postech.ac.kr. Thank you.
빠밤